Okay.
So basically, we put the camera inside. We were able to see what we needed to see from kidney on down. So basically what we do is we take the nodes essentially from underneath where the kidney is all the way down to on the basically up to where we dissected when we took the testicle out, okay? And so we sent, those are all now off to the pathologist. He's still asleep because he is getting his port placed by general surgery, okay? And so what will happen is after that is they'll send him up to the floor and he'll stay overnight probably, at the least. And we'll just kind of see how things are going today. He's got a bunch of little incisions, 5 little incisions, okay? So essentially, 1, 2, 3, 4, 5, okay?
So does that mean you removed 5 nodes?
No, we removed a lot, hopefully a lot more than 5 nodes. That's just, the nodes are on the inside, that's where our instruments went in. So where you see the little incision, we did it laparoscopically, meaning there's a camera on the inside of the abdomen. So we put that camera in through where the belly button incision was, and then our instruments go in through those we make little port sites, basically in the abdomen, and then we can slide instruments in and out. And so it's just it's a tedious process of basically just, we actually don't see how many nodes we get. We won't know until the pathologist tells us.
I see. Okay.
But what we do is nodes kind of hide in these what we call packets, and the packets have a lot of fat essentially. So even a skinny guy like him, we all have fat on the inside and on the outside too, even if you're super skinny. And so when you look on the inside, what you see are these areas of fat between like the major vessels and structures, and so you're basically just you're kind of taking all that out, okay? And so when you send it off to the pathologist, they see, if you looked at it just on the table, it would look like a blob of fat with a blood vessel running through it, which was one of the vessels that went down to his testicle, okay? But when they start to sort of pick it apart, they'll find little nodes and they'll look at them under the microscope, yeah.
Did you end up taking out more than you planned, just because of your visual examination, or you took out exactly?
No, we took out exactly what we thought we would do. Yeah, and we looked. There was some question on the left side about a node there near one of his blood vessels. We didn't see anything back there, and actually we looked back at the images on where when they did the PET scan, and just made sure that it didn't look like it was something odd that we needed to do differently, and we didn't actually. And I talked with the oncologist. I've actually called the oncologist, so I told him that as well. Okay. That we didn't go digging around somewhere else for something that was, suspicious on the PET scan. To our eyes in the operating room, it didn't look suspicious there. So I think we'll leave that alone. What it may have been that they saw, it's possible that it was urine draining from the kidney to the bladder, because urine lights up on that. And so it may have been in the tube that drains to the bladder. I'm not sure if that's what they saw, but that's kind of what it looked like. It would have been when we kind of compared him to the images. But everything went well. So I think, a certain amount, we just have to see how he does afterwards. As we said beforehand, sometimes things can happen after this. In the immediate period, things that happen are like leakage of things, either blood or lymphatic fluid or things like that. And that's one of the reasons why we keep him in the hospital, make sure he's doing okay, he's eating and drinking all right, everything looks fine.
How would you know if there was leakage?
So he probably wouldn't feel real well.
Okay.
If he got home and he got, if over a period of a week or so, if his belly ended up real distended or something, that's something that, would be obvious. So
Fever, nausea.
He could have a fever if something got infected. And you would know pretty fast. You would look sick.
So he had, after the previous surgery a few weeks back, he had a fever for a couple of days, but that wasn't necessarily an infection, right?
No, and everything looks fine. Actually, I looked at the spot that you guys were concerned about, and there's nothing worrisome there for a hernia.
Oh, great.
And we actually we're able to see that on the inside, and we have the camera there too, and nothing looks like a hernia.
Okay.
But yeah, to your question, I can't explain that. Okay. Sometimes after surgery, people can get fevers, and sometimes it's sort of has to do with pulmonary stuff that happens under anesthesia. Sometimes it has to do with your body doesn't really like being in one position and for long periods of time. And so funny things can happen in your lungs and elsewhere, and sometimes we think that can give you a fever. A lot of that's theoretical, but sometimes if we don't have a real good explanation for a self-limiting fever after surgery, that's what we say.
Okay, so it's not always indicative of as was the case a few weeks ago.
Yeah.
And were there any unexpected complications? Because I think you were in there for 6 hours, and we're not complaining. We're just like, we're thinking 3.5 hours, and it's 6, and this is just the first part of the.
No complications.
Okay.
Yeah.
Oh,
Like I said beforehand, it could take us
Yeah.
sure.
you know, a few hours, or it could take us a greater part of the day. So we just never know. You know, it's something like we definitely try not to rush through something like
Yeah.
this.
No, it was great.
So no, we took our time, and actually everything we did, we looked really carefully to make sure we weren't missing anything we
Thank you.
wanted. So no, it went very well actually.
I know you're trying to preserve nerves. You talked about that.
Yep.
So that,
Yeah, we definitely saw some areas where there were some nerves that we just stayed off of them. Sometimes you don't see things, you know, so I'm sure there are going to be a few nerves that we took, but again, typically things like that don't cause a major problem as long as you don't do this whole dissection that people sometimes need to do for more disease, okay? So that's why we do, and that's why the oncologist asked us for a limited dissection on the left side. So, which I think is very reasonable. And you know, occasionally we have to go back and do something. You know, if either if there's a problem medically with him going forward, if there are other things that happen, or something grows somewhere. But I think that for right now, we would just take what we could. These are the reason why we do this is these are the highest likelihood nodes for it to spread to. And so if we don't see anything else there, then we just say, that's good. Like if the pathology comes back and they say, no cancer in the nodes, then we would say, okay, that's good. We don't need to do anything else. It also makes us feel better. It helps the oncologist feel a little better with their management, and also, looking at how he might do going forward. Ideally he has no spread to any nodes.
Which is why they're waiting on that to give staging and to give prognosis.
Exactly,
correct?
exactly, yeah.
Okay. So now, if in the unlikely event that it has spread to some of those nodes, would you have to go back in, or is that where chemo comes in?
So it's he would probably get chemo, and a lot of this would be again a conversation between us and the oncologist. But probably the first thing he would get is chemo. Is that to say that there's no chance that we would go back in and look for something else? Unlikely, but and sometimes again it's unlikely that we would do that unless there was something really truly identifiable on an imaging study. That's another story, and sometimes that'll happen. If someone doesn't do well on chemo or something, and then because he'll get re-imaged, then
following the chemo.
If they feel like there's anything to worry about, and they may do it anyways. I don't know what their protocol is actually, but if there's anything worrisome on future imaging, they would actually, then we would end up having to take it out.
So are there anything that they need to be looking for with? I know we've got nodes all over the place. With these missing nodes, is there anything that could be a secondary from that?
Not really, because the great thing about lymph nodes is not like blood vessels. Even blood vessels do this to a certain extent. There's lots of what we call collateral kind of distribution of nodes, meaning that if you take something over here, a lot of times the flow will just go somewhere else.
Okay.
So if you're real aggressive, sometimes you can get lower extremity swelling and things like that. We just didn't really do enough to cause that.
Okay.
So is that to say that's impossible? No.
Right.
But it would be really unlikely. Again, it's one of the nice things about doing these limited node dissections is that we're not sacrificing something from a cancer perspective, but we're really hopefully sparing the potential things that you can injure, like nerves to bladder and nerves for erections and things like that, which is what we were talking about preoperatively. If you're real aggressive and you strip all this stuff dry on both sides, there's a reasonable chance that you have erectile dysfunction or some bladder issues or things like that. So, and higher risk of things like lymphatic leak, or the other things that we've talked about.
So, slightly different question. I know it's not part of your area of expertise, but obviously, do you think chemo is a benefit to him? Or?
I do, largely because the oncologists think it's a benefit to him, and those guys are pretty bright. So the thing about rhabdo is that it can be a really aggressive cancer, and that's why they don't take it lightly at all. So if there's any you know, if there's any indication for a chemo and they want to give it, I would say yes. That being said, I also think it's just pretty standard, you know, for a rhabdo, particularly when you're at his age. So things change a little bit once you know, the protocols change a little bit once you get over 10. Actually, had he been less than 10, we may not have done the lymph node dissection. That would have been a debate that we would have had. But once you get over 10, there's not much of a discussion anymore. We just go ahead and do it.
Why is that?
Because we know that the risk of spread in older kids is higher.
more aggressive.
Basically,
Okay.
once you become pubertal, things change a little bit. So that's why we do it.
Okay.
It's one of the few cancers that we treat that way.
Okay.
Yeah.
Because those cancer cells can be sneaky. They can hide, right?
Sure.
And that's
yeah.
why
Yeah.
why the chemo.
That's why the chemo. Yeah.
Okay.
Because we want to eliminate anything that's spread elsewhere.
Well, we appreciate your patience. We know we've been
Of course.
asking a ton of questions, and the fact that you took your time with our son.
No, of course. Yeah.
And I know we had like a follow-up appointment scheduled with you soon. We probably need to move that
Yeah,
out.
we'll adjust it. I think
Okay.
probably because so the oncology department already has a follow up for you Monday.
Monday,
I think. Yeah.
right.
So I think maybe what we'll do, since you have relatively quick follow up with them, is it'd be good. I want to kind of see what regimen they have him on.
Okay.
So,
With his recovery time, though, we thought it might be a little shorter. Do you think that Monday? I guess we need to talk to the oncologist. That Monday appointment's too soon.
I don't think so.
Okay.
No, I mean he should be home.
Okay.
Unless we run into a post-op issue,
Mhm.
but I don't think we will. So I think I would
Just keep
keep your
that.
Monday appointment. And he was actually happy that you had it. When I talked to him, he was like, "Yeah, good, because we have him on Monday, and he's
Okay.
gonna have his port, and so that's all
Okay.
gonna be set up." So he was pretty excited. Actually, he felt that things were moving along just as he wanted.